Some telling new numbers out of Texas this morning, where Governor Greg Abbott is fighting to limit the powers of schools and towns to make decisions on masks. The health department reports that more students tested positive for COVID-19 during 1 week this month than during any week last school year. 4 districts with the most cases do not have any mask requirements. CNN's Rosa Flores talked to some worried parents who want that to change.
Michelle Woodard sends her 8-year-old daughter Kara to school in Humble, Texas in a mask and shield.
I'm sending her to a war zone.
The district doesn't require masks.
I don't understand what kind of community behaves this way. And how can you call yourself a community when you don't care whether or not the people in the community live or die?
Nearly 3 weeks into the school year, Humble ISD reports more than 1,500 students and 300 staff have tested positive for COVID. Despite the growing numbers, parents dropping off their children at school not wearing masks.
It's a personal choice. If you want to do it, do it. If you feel safer doing it, do it by all means.
Everybody in my home, we vaccinated. So right now, the risk is lower.
This is Kara having trouble breathing in February 2020.
It was one of the worst days of my life.
She was hospitalized, Michelle says, most likely from COVID. And while she shared the video with some parents, she says it didn't convince them to mask their children.
This isn't a joke. This isn't politics. This is our kids' health.
Raise your hand if your child has asked you about death regarding COVID.
These moms want a mask mandate at Humble ISD.
I love my kids so much. I'm going to do every layer of protection that I can.
And say their pleas to the district have fallen flat.
I think it's going to take more children dying for them to step up and do something. And that's what is really scary and really frustrating.
We took their concerns to the district.
We're continuing to follow the governor's order, and masks will remain optional at this time.
But you understand why they have that concern, because the district is following a politician versus a medical expert, and all the medical experts say wear masks.
Well, we followed the governor's order last year.
There's no more time for government mandates.
It might be what Governor Greg Abbott wants, but in Harris County, where Humble is located, County Judge Lina Hidalgo says current law is the mask mandate she issued, which has been allowed to stand in Texas courts.
The most powerful tool we have is parents speaking up, is parents recognizing that the law is on their side.
She's burning up, but she's telling me she's cold.
Kara started feeling sick last week and tested positive for COVID.
Nobody in the school community cares about whether she is safe. And all of those thoughts just kind of culminated, and I just felt this rage. This was preventable. This did not have to occur.
Now Kara's in quarantine, a child who did her part and is left paying the consequences, her mother says, of other people's choices. Rosa Flores, CNN, Houston.
These decisions are out of the kids' hands. Let's remember that. I want to bring in CNN Chief Medical Correspondent Dr. Sanjay Gupta. You know, Sanjay, we talk about masks in schools, and there's some new modeling out which projects what kind of a difference it can make. What does it say?
Yeah, so this is based on looking at lots of different studies, observational studies, large studies like the one out of North Carolina, 1 million students. Let me show you. First of all, if you do nothing at all, just look at how contagious this virus is. They say at least 75%, 75 to 90% of children, if you didn't have any mitigation measures in place, will be exposed to this virus. If you do universal masking, and it's universal, right? Meaning that you have a much larger impact if everyone's doing it as opposed to sporadically doing it, 24 to 50%. So it's not perfect. You layer in testing as well, though, 13 to 22% exposure as compared to 75 to 90%. And other things like ventilation, and you can really start to bring down transmission within schools significantly. You know, one thing I just want to say is, as a parent myself, we talk about this all the time. This has often been presented as a benign disease in children. It's not. I mean, more children have already died of this than have died in some of the worst flu seasons on record. So three times as many children have died. Thousands are in the hospital right now. And I have to tell you, we still don't know the long-term impact of this virus. We just don't. You hear about kids taking these COVID naps for hours and hours after being diagnosed with COVID. You don't want this, and there are ways to prevent it, as you know, these statistics show.
And obviously, this is such a frustrating part for parents because they don't have the option to get their kids who are young vaccinated right now, as we are waiting to see what determinations the FDA and the CDC makes on that. But Sanjay, there's also a new CNN analysis that looked at the cost of treating COVID-19, comparing what it costs to be hospitalized to just getting vaccinated. And what did that analysis show you?
This is kind of mind-boggling, really, to think about, especially when you look at these numbers. Keep in mind there are states that are offering Visa gift cards for $150 if you show up as well, just to get vaccinated. But you know, it's free, right, for individuals who go get their vaccine. What does it actually cost? We dug into that. Medicare will reimburse about $150. It's $40 per shot. Administrative costs $35 more if they come to your home to administer it, on average. And 98% through June and July of COVID patients were unvaccinated. On average, what does it cost? About $22,000 for this hospitalization, 150 times as much as what Medicare reimburses for the shot. Someone goes on a ventilator, it can be up to 300 times the cost here. So, I mean, in terms of, if you just look at this from a purely financial standpoint, there is no question in anybody's mind. It's free, really, for people. You might even get $150 back in some states to get the shot, compared to tens of thousands of dollars for the hospitalization.
I've never been good at math, but
I was just going to say the same thing.
But the math there is extraordinary.
But it's obvious. You get paid in some instances to get vaccinated. And that's why it blows my mind people are paying for vaccine cards. You could just get one for free at your local pharmacy.
Also, you know what? We all pay for this. When someone has medical bills that are $22,000 or $49,000, it drives premiums up for everybody. And there's one other thing. You might die if you get COVID. And if you get vaccinated, you almost definitely won't die of COVID. So add that to the dollars and cents equation. That's an extraordinary number, Sanjay. I appreciate you showing us that. Look, a little bit more news. The CDC vaccine advisors met to discuss boosters. What was learned about where things stand?
Let me show you the graphs. We pulled this from the meeting here. And as you're looking at this, one thing I'll tell you, this is not a slam dunk decision within the scientific community. They're very divided. I've spent the weekend talking to lots of people who say, look, boosters are absolutely necessary. You've heard people say that. There are other people who say, show me the data. So here's some of the data, and you do see that it's a little bit hard to read, but on the left side of the screen there, you see that there is a waning of protection in terms of people actually being diagnosed with COVID. Pre-Delta on the left, and then post-Delta. You see that drop off. That could be people who just come back with a positive test. It could be people who have some symptoms. But let me show you the next screen, and I think this is what really sort of grabbed my attention, grabbed a lot of people's attention, is that if you look overall at hospitalizations and deaths, the top lines there that are flat across the top, those are the youngest age groups. There's hardly any drop off in terms of efficacy, in terms of effectiveness. If you're 75 and older, you do see some drop off there. That's the line that's sort of going down to the right, but to about 80% versus 95% in the beginning. So there's some drop off, and it may make the case that boosters are necessary, but for certain segments of the population. We saw them for immune compromised already. Maybe it's for vulnerable people based on age as well. We'll see. The CDC's got to weigh out on this and formally recommend it. And I know a lot of people have taken it as preordained that boosters are going to happen. But we can tell you, just talking to many of these scientists, it's not a slam dunk. There's still a lot of discussion on this.
All right, Sanjay, I know you're watching it very closely. Dr. Sanjay Gupta, who of course has a medical degree, he's good at math.
Much better than take his opinion, not ours.
Well, no, I mean, look, there's a reason we become reporters. And one of them is we're not good at math. I mean, Sanjay aside, we're not usually good at math.